Uh, I am Dinah Fox, and we welcome everyone to come to this meeting this evening. We're very glad to see you. Hope you all had a very nice holiday weekend. This was going to be the last meeting of the year, but we're going to be adding one more meeting. Together with some other folks, I attended the National Self-Direction Conference 2022 in Baltimore, Maryland last week, and shared discussions of what is happening in self-direction across the country, and learned some very interesting things. So we will be having one more session before the summer, and that's scheduled for Tuesday, May the 24th at 7 p.m. And again, we're going to do it virtually and invite you to join us. So while this was going to be our last meeting for the year, we're adding one more next month, Tuesday, May the 24th at 7 p.m. And we'll be talking about the National Self-Direction Conference and what's going on nationally. In that, we will line up our speakers for the fall and next spring. Anyone who would like to send me their thoughts or recommendation or ideas for speakers, please feel free to send those to me directly. You have my email because I've sent out all the announcements for these events. We're very excited to have a number of people joining us here from Patricia Brennan's group. And I'm going to invite Margaret Hefferly to introduce her. I will say that the format for this evening will be a presentation, and then we will have questions after that. And we shouldn't go even to 8:30 or 9 o'clock. So it's not going to be very long, but we invite you to offer up your questions after the speakers are done. Margaret, thank you so much for coordinating, and I invite you to introduce Patricia Brennan.
Great. So my name is Margaret Hefferly. I'm the chair of the Regional Family Support Planning Council #1. That is for Morris, Sussex, and Warren counties. And this is, I believe, our third collaboration with the Morris County families. And, you know, their last collaboration brought out so many people that we've asked that New Jersey Council on Developmental Disabilities to help us host this. So the Regional Family Support Planning Councils are a project of NJCDD. So families can find, you know, their own council if they're not from our area. So yes, I did want to introduce Trish Brennan. She's the current director of the new Office on Self-Directed Services and also the director of the Waiting List and Special Projects at the Division of Developmental Disabilities. She's worked in the field of developmental disabilities for over 25 years and has been with the state of New Jersey's DDD program since her university master's of social work placement at DDD. She officially entered service with DDD in 2000 and has been working to move the system to more person-centered practices and to provide self-direction as an option since 2002. And Patricia will introduce her staff that are presently here.
So welcome everybody. I am extremely excited to be here. We were supposed to, the first time Margaret actually approached me was we were just going to schedule for March of the year that COVID came through. So we were supposed to give this presentation in person at night. So I'm actually kind of grateful I'm not traveling at night to do this presentation. And things have completely changed in more of an awesome way since then, for the simple matter that we now have an Office of Education on Self-Direction. If you participated in the Self-Directed Conference you heard, or in one of the webinars you heard Jonathan announce our new office. And I do have some of my staff here tonight to just, introduce themselves and tell a little bit about them. I'm not sure if Jessica Lycona, my assistant director, is on. If she is, I will ask her to say who she is, but I'm not sure if she had a conflict and so she may be traveling, but then listening in. So I don't know if I don't see her. But I am going to kick it over to some of the staff that are sitting in our Flanders office, and then we'll work our way down. So again, Jessica is the assistant director, and then I can move it over to Christine because you're the next one I see, and we're going to go off from the top of the state down.
Hi, I'm Christine Jones. I'm a supervisor in the Flanders office.
Awesome. And then Kim.
I'm Kimberly Jessamine, and I'm a supervisor as well in the Flanders office.
Awesome. And then Adam.
Good evening, welcome. My name is Adam Weir. I am a supervisor and I am located in the Trenton office.
Awesome. And he also shares an office, and I think Will might be on, Will Phillips. If Will is not, I did see him coming. It was coming through. I did see him pop in, so I know some of us were having some technical issues. And then go all the way down to the bottom part of the state, Marguerite.
Hi, I'm Marguerite Lunchaman, and I'm supervisor in the Mays Landing office.
Awesome. So we now have an Office of Education on Self-Directed Services. I'm going to talk a little bit about that. Our new office, I've got some initial slides. So this presentation is completely morphed since the initial time that we were going to talk about this, that Margaret first approached me. And I'm extremely excited about that. So I'm going to start sharing my screen. So give me just a second. I'm going to share my screen. I have a presentation for all of you. If you do have some questions, you can either save them for the end, or if they're really pressing and you want to just get them out and write them in the chat, we do some of the stuff. We're going to be able to answer them within the chat as we go through. But I did want you to kind of put some faces to names, especially since we're not in person. So I wanted you to say, see who our team is and what, what we're all about, and that we do span the whole entire state to really become the subject matter experts on self-directed services. So I'm going to start sharing, so just be patient, because sometimes it works, sometimes it doesn't. IT was already in my office earlier today because my one camera broke again. I have camera problems. Okay, can you see my screen?
Yes.
Okay, awesome. So I'm going to show it like a slideshow so you don't see all the other pieces. So just give me a second here. It is not, just give me a second. My cursor is not moving where I want it to be. Just please be patient. One moment, please. There, oh, well, I gotta go back a slide, but just, there we go. So again, we're the new Office of Education on Self-Directed Services. And tonight I'm going to talk to you a little bit about what our office is, a brief overview of self-direction, and some support brokerage services as well. A glossy overview of everything, but if you have some pressing questions, please, free to go ahead and ask them in the chat. And then otherwise you can raise your hand with using the hand emoji when we're done at the end. If I could find my thing to move through, there we go. Yeah. So today we're going to talk about what our new office does, what our goal is, a brief overview of self-direction, and then just give you an opportunity to ask some questions. I have been starting every single one of my presentations now because I really want, with the mission of the division, because I want us to get grounded into the why. The why are we doing this? What is the goal of what is the true mission and goal of the Division of Developmental Disabilities? So the mission of the Department of Human Services Division of Developmental Disabilities is that DoD assures the opportunity for individuals with developmental disabilities to receive quality services and supports, participate meaningfully in their communities, and exercises the right to make choices. Again, that is really the whole root of the eligibility services through DDD. One of the areas in which we've been focusing a lot of our energies is that we are a member state of the community of practice for supporting families. And the core belief that we've been working on is that all people have and their families have the right to live, love, work, play, and pursue their life aspirations in their communities, really focusing upon communities and having people as fully integrated as possible. So a little bit of a background on how our new office came to be is that the Division of Developmental Disabilities has been committed to providing people with intellectual and developmental disabilities choice to self-direct their services for over 20 years. In 2002, I was actually at the table when a core group of family members sat down and said to us, if you gave us those dollars, because it was a contracted system at that time, everything was contracts, we could do it better. And we sat down and we helped design and we morphed to a system where it was either contracted or self-directed. And then we moved all the way to fee-for-service. So the division shift to the fee-for-service system strengthened our commitment as there's now more flexibility and ability to choose the supports and services that a person is actually receiving. With that, now that we have everybody, almost everybody, because one of the other charges within our special projects action in our unit is the complete and total moving to fee for service, and we are just under a little under 100 people still just to move over to completely to the fee for service system. So our whole entire system has overhauled. And with that, we wanted to really make sure that people understood the value of self-direction, that it was an option, that it wasn't just everything had to be, you can pick and choose in a fee for service system, your provider. You can pick and choose how you provide your services, where you get those services. And we wanted to make sure we emphasized and educated people on self-directed services. So that's why we have the centralized place that is, again, brand new. We just started working and building the new team, and everybody has been on board since the end of February. So you've got to give us some time to get acclimated to things and learn and listen and figure the next things out. But our goal is to provide a centralized place for the delivery of education and training for people with intellectual and developmental disabilities receiving services, their families, advocates, support coordinators, interested community partners, and other internal and external stakeholders. So a goal of our unit is to really make sure that everyone gets that right education as to what available options are out there for everybody. And we are staffed by subject matter experts to help people understand the best practices in self-directed services, to provide education and support so that people under the division services can live their best lives. Some of our responsibilities is education of various stakeholders and utilizing guidance and tools and the benefits and the responsibilities of self-direction. We're going to be facilitating networking meetings with people under division services, their families, advocates, providers, and other interested parties. We've already started to partner, just kind of give a little plug for something upcoming, but we have been partnering with the Community Living Education Project. We're going to be starting to have some networking focus groups for families who are self-directing, interested in self-directing, just want to have some conversation, and we are starting them in May. We're also, one of our other responsibilities to provide technical assistance for support brokerage services, including agencies seeking to provide the service, people and their families seeking to utilize it. So we will be working with providing best practices in support brokerage. I will go more into support brokerage in a little bit. It's a service that was written into both the supports program and the community care program, but had not really been launched until the November before, and I don't mean to say before COVID and after COVID, but it was the November before we all went on that hiatus for working from home and everything changed. So we really launched that service and to really build it, because it is a critical piece for people who are self-directing if this is what they're looking to do. We're also going to be engaging in work to better integrate information about self-direction into our division service delivery system. That means we are participating in the national forum. So as Dinah had spoken, I was able to go this past week. We are part of a new learning collaborative with applied self-direction and the national group, the NCAPS group, and the self-directed learning collaborative we've been accepted into, and we just started doing some of the work with that. We did a storyboard and we're doing some of the great work with that. We started today. We have more brewing. So this is all new stuff to really make sure that we have the national trends and best practices, and that's what our unit's going to be working on. So again, one of the things that I want to touch upon is we've been really trying to infuse all the community of practice tools, the Trying the Life course framework into everything in which we do as we support people throughout their lives. So the services and supports throughout our system have been evolving. So in the past, the person was at the center, the family was around them, and the community was around them. And some of you who have may have seen these slides before, but I think every time we see them, it resonates in a different way. And then we moved to having actual services. So there are traditional disability services. So it was the person, the services, the family, and the community. But now we're seeing the value and how it should be that the person is there, supported by the services are peppered throughout, so they can be fully immersed within their community, within the context of the person's family. So what is self-directed services? And this actually came from the national definition. It's an alternative to agency delivered model. So what we would see as the provider managed. The person, not the provider, has the authority to hire, screen, train, and supervise their own staff, such as self-directed employees. Person who is self-directing their services utilizes the Fiscal Management Services Agency. In New Jersey, you call it the FI, Fiscal Intermediary. In New Jersey, people can self-direct some or all of their services, which may include self-directed employees, accessing programs, classes, goods, and services through a community vendor. Again, this is a complete and total paradigm shift. So in the past, as our services have evolved, people were all provider managed systems. So the professionals were identifying the type of supports provided by the organization, by the all. We've moved to the person is the expert at identifying the needs, preferences, desires, and supports. Again, in the past, the traditional agencies took responsibility for employing and directing the support workers. We're now with person self-direct. The person hires, trains, supervises their staff, and any other generic community resources. In the past, the professionals were determining the support strategies that were implemented by the service providers. As we move towards our services evolving, the person is at the center and they are directing their supports and services. What is not self-directing? So a lot of times people want to know, okay, so you're telling me what self-directing is, but what isn't self-directing? If a person is not utilizing the fiscal intermediary for any aspect of their supports, they are not self-directing. If they're living in a licensed group home or supervised apartment, they're not self-directing. We would hope that everybody is as person-centered as possible and employing the best practices so that they're person-centered. They're not following true to that self-direction model. Again, the person is at the center. If somebody's for all aspects of person, we should be looking throughout our whole entire system that the person is at the center. If they're self-directing, the person should be having their complete circle of supports around them and being at the center of the supports and services they're planning for. So what can a self-directed employee be hired for? Some of these things, maybe you've done it. Some of the folks may know the answers to some of these questions. So I'm going to kind of go through some of these slides quickly because they are in our manual. But the community care program and individual support staff, interpreter services, respite and transportation, supports programs, same types of things. Again, their self-directed services are available through a community vendor as well. I will also, I know I always get this question, will I get a copy of these slides? I can get a copy of these slides out to Kyoko and she can get this over to you at the end of this as well. So if there's something that you may have missed or you worry about, I'll make sure you get that information. Self-directed services and provider services. People have choices and options in the fee-for-service system. So you can choose if you want to self-direct or you want to provider manage. And you can do a little bit of both. Some people may choose to do a little bit of both and that is still self-direction. So I've got two slides here and they talk a little bit about how, just to get your mind churning a little bit. So say, okay, so what does it look like? If I want to self-direct my week, how can I make that happen? Sometimes I may want to go to a traditional provider because I really like what they do on Mondays and Wednesdays. But in the afternoons, I want to take a class. Maybe when I go to dinner with a friend, or maybe I want to go to the gym and I need my self-directed employee beside me to help me maneuver some of the activities there. So just figuring those pieces out. So you could have a completely blended week. A completely self-directed week would not utilize anything that is provider managed. It would be totally and completely created with the assistance of the family, the person, figuring out the support coordinator, helping those pieces, maybe a support broker, figuring out, okay, so what are we going to do each day of the week? And where do we need support? And where do we want to go? And what locations in my community do I want to access? What community venue do I want to go to? Where do I want to figure those next steps out? So what is the fiscal intermediary? So there's a private contracted agency to manage payments for employees and vendors from funds that are allocated by the division. So dollars never actually go to the person. They go through a fiscal intermediary. So what do? They supply and process the forms needed to complete employer enrollment and employer hiring. They provide orientation and training on the FI program rules. They process and issue employee and vendor payments. They ensure employer and employee taxes are appropriately withheld, filed, and paid. What the FI does not do, they do not find your staff for the person to hire. They do not supervise the day-to-day activities of the staff hired, and they do not coordinate schedules. In New Jersey, we have two models. And this is recent. At one point, we only had one model. We now have the agency with choice, who is Easter Seals, and we have the public partnerships, who is the other fiscal intermediary, the vendor fiscal employer agent. I'm going to go through these slides a little quickly, but the rest of this information is available on our website. Again, you will get copies of all these slides. So again, there's two FI models. And what's the difference between the two FI models? If you're utilizing PPL, the employer of record is the person or the family member. If they're using the agency of choice model, Easter Seals, they hold the employer of record. Again, two FI models available now in the state, and each of them have a little bit of differences. It is your choice as a person who is in the driver's seat. It's the person's choice if they want to utilize the FI, which is PPL, or the agency of choice model. And this side by side is available on our website. You can just click on the division's website and you'll find all of this information. Additional information is here. You will get copies of all these slides. So if you're hot, one of the things that if a person is self-directing their employees, they need to be recruiting their staff, writing a job description, interviewing the candidates that fit right for the person. And we do see a lot of times when you are hiring your own staff, there's almost a larger amounts of people have satisfaction because they're picking and choosing who provide their supports. They have complete and total choice as to who they hire, what they hire them to do. They also need to be responsible for their job performance, providing them feedback, doing some of their training, making sure their timesheets are done, figuring out their hourly wage. All those pieces are part of self-direction. Goods and services is another thing you can utilize through self-direction. It's available in our manual. There are many different things you can utilize goods and services for. Classes is one of them. Any class that the general public will be taking that can be part of it. Activity fees, medical equipment, etc. If someone is self-directing, they also are able to utilize a housing voucher. I put this slide in here because it's part of the Charting the Life course tools, and we wanted to encourage people as they are moving through their life and figuring out, do I want to self-direct, or want to go provider manage? What works for me? What doesn't work for me? The different innovative options that are available to them. And as you can go through the different stages, and the link to these tools is on the bottom of the slide. Additionally, Trying the Life course tools have different guidebooks, and they're called Life Experience Quick Guides, and they're very powerful and very helpful. And you can get them from these sites as well, and you can utilize them for any. I wanted to give, as I was asked to come tonight, I wanted to give you all little bits of pieces that you can go back and say, well, maybe that would work. Maybe I could check this tool out. Maybe this could really be helpful for my upcoming planning meeting and figure the next steps out. So these are just additional tools that will help you figure out, is self-direction what I'm looking for, is provider management what I'm looking for. As we go through life, what are the good questions I need to bring to the table when I meet with my support coordinator? How do I get there? This is another tool that we use for a lot of things, and it can be used for absolutely anything. So it's the Integrated Support Star, and it helps you sort as if you're, going to your upcoming annual planning meeting. It helps you sort, okay, so what are the personal strengths of the person? What are the community-based resources that I can utilize? What are the eligibility-based resources? What relationships that I have that are key to me? What technology could we use? Maybe we could use technology instead of using an individual support staff. How can we figure those things out? And then it also talks a little bit about mapping family roles, really thinking about and taking the time to think about, okay, so I want to build my circle of support. Who is responsible for caring for me and who is responsible for caring about? A lot of times we hear moms say, And I've said this a couple times. Sometimes I just want to be mom. Like I just want to be the person who sits on the sidelines that doesn't actually provide the support to the person, just sits and watches the game or watches the activity. So figuring those things out, and you can map those roles out and figure out who you can call upon when you're building a really good, rich life for somebody. So again, I'm just trying to get as many tools out there and get your minds all churning. So as we move to figuring out, okay, is self-direction what I'm looking for? Is provider managed what I'm looking for? What options does the division provide as we're going through eligibility services? What's in my community? Tonight I wanted to give you as much, saturate you with all the tools that we have. So as I'm saturating you with tools, the other one I have is the life course trajectory. So in the life course trajectory, some of you may have heard some of this information. We have been working as part of the Charting the Life course and the community of practice for supporting families for almost 3 years now. We help people get to the next step in their life. A lot of times, my team, as we also work on the waiting list, we've been working with families saying, okay, so now that you've been reaching the priority list, now what? What do you want in your life? And a lot of times people can't figure out what they want in their life, but everyone knows what they don't want in their life. So people know, okay, so this is what I don't want to have. As I'm moving forward towards my next year plan, and I'm looking through and saying, what, how do I get to those outcomes, the end goal of what I want for this next upcoming year? What don't I want? What didn't work in the past? What did really work? What do I want to improve upon and enhance? And what do I want to change? And figuring all those pieces out. Again, this is just another one of these tools. A lot of times when I'm sitting down and talking to somebody, I just start drawing this out on a just blank piece of paper. Okay, so what don't you want? What do you want? How can we get there? What are our next steps? And this really helps when you're trying to figure out, do I want to utilize a provider for this service? Or do I want to utilize somebody in my community? Do I want to hire my own staff? How do I get there? Do I want to, be in charge of this aspect? Where do I go? These are some of the tools that will help you figure out, do I want to self-direct? Do I want to go provider managed? What other options are in my community? So again, tonight, I just wanted to saturate you with tools so that you could have as much knowledge as possible. So a lot of times we hear from families and they say, okay, all this sounds great, but self-direction seems like it's a lot of responsibility. And the tools you gave me are great, but it's still, again, it's a lot of responsibility and I can't figure out how to do some of these pieces. What are my next steps? I don't even know where I'd find a self-directed employee, or if I posted for a job, I got all these resumes back, who's going to help me go through them? I can't figure out where to go, in my community. My son, my daughter wants to join a book club, but they're like 6 book clubs, and I don't have the time to figure those pieces out of what's the right book club for me. So support brokerage is a service that New Jersey offers. It comes out of a person's budget, and they help guide the person and the family figure those pieces out. It's designed to help people use self-directed supports and services effectively. It's available in both the community care program and in the supports program. So what does a support broker do? So they may assist the person and their family representative with tasks related to self-directing their services. So they're going to help. It's custom based upon what the person is looking for. So they may help with arranging for, planning, accessing, and managing self-directed services. They may help with being a responsible employer, including recruiting staff, helping interview, helping hire, helping figuring out a person's calendar, helping evaluating staff, understanding responsibilities associated with self-directing services, helping self-directed employees understand how to complete timesheets, including how to enter service documentation notes, helping make sure the self-directed employees understand and comply with rules and regulations. So they're going to help guide a person through this process. So if they choose to self-direct and it seems like it's a lot to do to figure out next steps and all those things that go along, especially the core responsibilities, a support broker is going to help with those pieces and also help with establishing circles of support within a person's community. So they also may help with community mapping, figuring out, as I said before, what the right book club to join is. They may take that first look and figure out, okay, so that book club's not going to work because the person's wheelchair is not even going to fit through the door. And that book club's not going to work because they were trying to set up it's a young man who wants to find a book club, and that book club is full of older women. They're going to help also facilitate the circle of support. They're going to learn about the person's immediate and long-term needs related to self-direction, what they really truly want. They're going to help them with getting that information down and help them guide them through the process. They could be helping a person through interviews. If they're interviewing a self-directed employee, they may help them with sorting through resumes, posting jobs, figuring out where they want to go in their community, what type of activity they want to participate in, figuring out who their great connections are, where the volunteer opportunities are. They're going to help them find and access natural and generic supports in their community and build that really strong system of support. We heard last week at the Applied Self-Direction Conference how you can't really have good self-direction without really good community connections and natural support. So they're going to help you through that process if you choose to utilize a support broker. So again, support brokerage is available to people who self-direct some or all of their services in their service plan. Support brokerage cannot be provided by any DED provider of residential services, anyone who resides with the person receiving services. The support broker does not perform the employer-related tasks for the person, but they provide assistance with the tasks. They're not going to duplicate support coordination services because the support coordinator is going to put the services in the plan that you're looking to receive. But they're going to work in tandem with the support coordinator as part of a person's team. They're not going to make referrals or connect you with the traditional DED service providers. They're going to help a person truly self-direct and utilize that fiscal intermediary for their services and supports. And the support broker should not be providing any other service other than support brokerage to a person. The person opts to hire a support broker. It needs to be incorporated in their plan. It needs to be part of their outcomes. It needs to really focus on hopes and dreams and help them achieve their hopes and dreams. It's going to help them with relationship building as well. So again, support brokerage is rarely a standalone service, and at least one self-directed service needs to be included in the person's plan if they're utilizing a support broker. Sometimes you may see people utilize a support broker for a limited period of time, and they get the supports and staff and everything going, and then it tapers off and then it comes back. It ebbs and flows depending upon the person's wants, needs, desires, and how things are going in their life. So it just depends upon what the person's looking for. Everything is person driven. The person is in the driver's seat for all aspects of self-direction. Again, all this happens within a team. So it's never done alone. Everybody needs to be working in collaboration with each other in order for this to truly work. And it does truly work. We've seen it. There's so many different awesome stories we have. And that's why I want to get these networking sessions going so we can get people sharing their great stories and start thinking, oh my gosh, that's something that I could do. Or what didn't work for you? Tell me what happened when things didn't work. Tell me what, where were your bumps in the road? Let's figure these things out so we can all learn from each other. I've got on here some helpful resources as well. More resources. And then this is our team, and we have a help desk. So we are, if you have any other questions when we're done after tonight, if you have additional questions and, we end tonight and you say, oh, I forgot to ask. We have a help desk. The staff that you met tonight, as well as some of the other staff, somebody is always staffing the help desk each day, making sure they respond to people, making sure they answer questions. We can go out and do presentations like we're doing tonight as well. So we really want to provide, or if a family says, I'm struggling with trying to figure out if self-direction is going to work for me, or if it's not going to work, or what I want to do, we'll just talk to you through those pieces to provide you technical assistance for families. That's what our unit is here for, to really provide that assistance to families if they're figuring out the next steps, or an agency who needs additional assistance, or anybody who asks questions about self-direction, you can write into us as well. So again, extremely excited to be part of this new unit and to be able to really get back to some grassroots and follow some national trends as well, so that everyone can access self-direction. I have not looked at the chat, and I hope that and my staff has been doing that. So some folks have been and some have not. Here we go. So here we go. Got some folks asking some questions. So if people want to raise their hand, that's fine. I'm going to also start to look through some of the questions as well. Again, I will have slides for the slides. I will get these over to Kyoko and she can do that, get them over to everybody. So there's questions about support broker. What type of the training? All support brokers have to go through the training that we have through the Bog Center. Support brokers can be found if you look at our provider search. The amount that comes out of your budget, it can be found in our manual, and additional information about support brokerage, such as that, can be found in our manual. But again, in addition to provider search, I can give you these statistics and that is that there are currently over 80 providers who have gone through the process of being able to provide the service, but there are about 18 agencies who are currently providing support brokerage, and there are about 100, just under 150 people who are actually utilizing a support broker. And if you ask some of these questions and that are specific, we can provide that information when you write into our help desk, and we can get you additional information. So self-directed services is once someone is eligible for our division services. So for youth who are in the children's system, not at this point for our pieces. Family members are, it's written into our community care program manual and support program manual to be able to be SDEs. Jen answered that question. Thank you, Jen.
Trish, there's another question on that. How much longer will family members be allowed to work as self-directed employees?
It's in the manual that they are eligible to be self-directed employees.
Permanently.
Yes.
Thank you.
Yes. Looking to see if there are any. Scroll through the chat as we're talking.
Another question, Tricia, what is best practices?
I'm looking to see, in reference to self-direction, in reference to.
I think you just used the term a couple of times and people are just wondering, what does that mean?
Whatever the national best practice, we really want to make sure that we are on the cutting edge of what everybody is doing nationally, for remaining true to the definition, the CMS definition for self-direction. Sorry, I'm trying to scroll as we're.
What type of training do support brokers have? Where do you find a support broker? What are the costs of the support broker? I saw Jen answer that question, that last one. Thank you.
Yes. Joe Agner, our Flanders office, there are two ladies in the Flanders office are here tonight, so they can wave at you if you want. Christine Jones and Kimberly Jessamine. So they're in our Flanders office.
Trish, there's a question. Can a relative that doesn't live with the person with IDD be a support broker?
At this time, that is not an option. We're still working on some of the pieces of support brokerage out. So again, it's newer service. We're still working pieces out for that. If they're working for an agent provider agency, that's a little bit different. Let's see.
We do have a hand up. Amy
Oh.
Lerner has a hand up. Are we going to allow some questions live? Is that okay?
Yep, that's fine. Hi.
Hello?
Yes, hi.
Hi. I wrote my question, so you can either read it or I can say it, but this is the question I ask all the time.
I know.
Mercedes has heard it so much. I have full-time people and they get time off, and this is never going to work for me, especially after my husband and I are gone. If they can't be paid overtime, they can't cover for each other. And I can't tell you how many years I've been told, oh, get somebody from an agency. But my daughter doesn't do well with strangers. And if I've got people that are great with her and I've got plenty of money in my budget, it makes no sense to not have the people who work for me cover each other.
Ms. Lerner, you and I will talk to you and like a little bit. I hear what you're saying. And I know that you brought this to Jonathan's attention as well. So I will address this with you later on this week, if that's okay.
That's fine.
Okay, cool. And then Chrissy, I see your question. So yeah, we compiled that list of the 18 support brokerage agencies. We've put it together and we've been sending it out when people write to us. So that, so we have that list. And as more agencies, so I partner with Colleen over at the Bog Center. And so as some of the new people come through training, they get added to our support brokerage listserv. So we have a listserv, just so you're all aware. And I know there are some support brokers on this meeting tonight. We do partner, we have a listserv so that support brokers can lean on each other to build their own, to ask questions, we did a couple different sessions with different things about building circles of support, then utilizing the New Jersey Collaboratives and their map. We've also done some sessions with each, so that folks can, if you're a support broker in one part of the state, you can share your experiences with other support brokers, or they can just throw different things out on the listserv as well. So one of the most frequently asked questions since the end of February, I believe, and I mean, I think some of my staff could probably nod their head, is that, can you tell us who the support brokers are? And we've been going through and trying to get the utilization reports and figure out who's utilizing who in what parts of the state, and gather all that data. And when people ask us for it, we've put it into a chart and been able to send it out to them. So hopefully that is helpful.
Thank you.
There's another question. First, I guess a comment. Some individuals have such a small budget, they might not have enough to pay a support broker. And then the second follow-up to that same person is, any ideas to alleviate transportation problems? Transportation can be very difficult.
Right. So I mean, transportation is definitely a problem throughout the whole entire state. No matter where you live, it's an issue. So that is something that we are actively working on in all aspects of the division.
And when you say working on transportation, do you mean because you get a choice of mileage reimbursement or the hourly rate, and you've probably heard this before. So the issue is, let's just say I can find somebody who will take my brother to the day program because I'm out of range. You know, the person's not going to want to drive like a half an hour to pick them up and take them there and a half an hour back. So that means they might get like, it's just not a good choice. I'm wondering if they're going to broaden things to make it, not to make a person rich for transportation, but to make it easier for us. because it's just not, I can't blame the people for not wanting it,
Right.
Did I say what I said correctly?
You said what you said correctly. I just don't have the best of answers for you right now, honestly. I'll be honest. So.
And back to the support brokers, you said there's a list. I did not hear you say iRecord, through iRecord, or is it a separate list?
We actually, so you can do the provider search, which, we know that it has everybody who is put in that said that they do want it, they would like their, they wanted to go through the game of qualification process for it. But we have gone through our utilization report and who's been trained, and we put together our own separate of, okay, so here's the people who are actually doing it. And trained to do it. So we have a different list that's a lot smaller than the 80+ people who are in the iRecord provider search. We have a smaller list that our staff have put together since we've gotten this question so many times through the help desk. So we put together, we get the utilization report at the end of the month, we make sure, and then we kind of put it together as to who's been through training and who is actually providing the service.
Because so it sounds like it's a separate list.
It's a separate list, yes. So
thank God,
we've
because
done the extra work so that it's easier for families to ask us that question. And, it doesn't mean that people aren't able to do the service. It's just that these are the people who are doing the service right now.
Right, because iRecord is not up to date. It's not
Understood.
Up to date. So we would go through the support coordinator to get the list. Am I correct?
Well, actually, your support coordinator is going to have the same iRecord search. If you write into our help desk, we can get that to you. Actually, Christine just responded to someone so that you'd be able to get them that information.
Mm-hmm.
So we've gotten that question quite, many times. And for those of you who've been with us since the end of February and started asking that question, we've made it a little bit better, and we've ran through all the utilization reports and come up with our own special list.
Good.
That we'll get out to people if they ask us for, like, can you tell us who is actually providing it right now? We will get you over that information.
Trish,
So that's one thing we've done in the past month that we've been up and running is, acted upon some of the questions we've gotten asked and made it a little bit easier for families to look.
Yes, thank you. Till they get iRecord together.
Thanks, Darlene. Trish, there's another question. Some community care program participants who live in provider-managed group homes are electing to customize day services in lieu of a day program. So would this be considered a blended service?
It would not, unless they're utilizing the FI to be the provider of that service. If it's all provider managed, it's provider managed.
But if they look to customize and not use the day program, which is
it's person-centered, but it's not utilized, it's not self-directing.
But if they want to customize day and not use a day program, they want to, to take some classes during the day, they want to purchase other services as self-directing services, can they do both?
It depends upon, so that's a different piece, because if the agency is billing on the daily rate, they can't be having, it depends, so they can't be doing that. So there's different areas. So it would be if they're utilizing a provider. This is a more very specific question, and it's been getting asked more recently. So I will be formulating a better answer to that question, but it is not the true essence of self-direction, because they are living in a provider managed setting.
It's certainly worthy of some discussion, given that.
Right, and there's some of the discussions on that, have just started.
Many day programs did not fully reopen, and or people who didn't go to day programs while they couldn't because they were closed, developed other interests, and maybe day program is not what they want to return to.
Right, and which is great to see people, branching out, looking to hopes and dreams, but it just depends upon, because we can't be billing for the same service at the same time. So it depends upon what they're doing.
Then there's a question, PPL said they pay 31 cents a mile or the hourly rate, but federal government pays around 57 cents a mile. with the cost of gas, that's asking a lot of our SDEs.
I agree with you on that.
Do you have a magic wand tonight?
I was just gonna say, do you don't know what I got reimbursed for? I traveled to Baltimore.
Yeah.
I'm sorry. With 35 cents to 37 cents a mile. So,
And there's a couple of comments about that, how, it's just a lot to ask an SDE.
right. And Mary Claire, that question is a great question that we have been, if you want to have your staff meeting with all your staff, how do you get all the staff paid for attending the meeting? So that's a great question. And that's something that there are different pieces that I learned about in the past conference of how some states are doing it a little differently. And I've been trying to bring that information up. So yeah, that is a really good question because that's an actual staff meeting with your staff. So.
And there's a question, there's a lot of work involved in applying for SNAP, utility assistance, renewing rental vouchers, low-income phone assistance each year. Will support brokers be able to help make this easier for families?
Yes.
So they can be retained to do any of those services?
They wouldn't do them for the person. They could help the person with those pieces.
Okay.
So they'll be able to provide them some assistance.
So so I think that was a follow-up to the group home person. The question was from 9 to 3, can they have an option to request to use incremental individual supports to be supported by staff during community-based activities? That's a follow-up kind of to that question of somebody's in a group home, but they want to do some self-directed during the day.
Right. And again, I will be working to get a better formulated answer to that because things have changed, but at this point, it's not the true essence of self-direction. But we want everyone to be as person-centered as possible, so we want to make this workable within our system.
So because these are issues that people are raising, Trish, is there an opportunity to either put some time frame or to get some, more granular input from people who have these issues that they're experiencing so that the decision can hopefully solve those issues?
Yes. So what I can tell you is that our team has been coming up with different solutions and trying to figure out, and also learning what other states are doing to make this workable. So I was bringing this to, up higher to try to figure out, how we can make this work within our community care program and our supports program. But I did learn a lot last week about what other states are doing to make it work. So. And what other states, what didn't work for some other states too. So trying to make sure we formulate the next best things for each of these pieces. So give us a little bit of time to get up and running. We are in that phase. Our unit is in the phase of listening to folks, hearing where the barriers are, hearing the issues, figuring it out. We've only been in existence since the end of February. So that's not that long. And we're trying to do gather the information, and we have joined and elicited a lot of different collaboratives, learning experiences, and really focusing on how we can put forth, and I'll say it again, best practices, but what the states have really worked best for all the states and where we have the true essence of being the national definition for self-direction, so that New Jersey can be at the forefront as we develop things, and so that it is, our infrastructure is so strong that if there are any, systems changes, administrative changes, that it's not going to go anywhere. So that is one of our core pieces. We want to make sure that, self-direction has a lasting imprint in the state, and making sure that all the pieces are in place so that it is always a viable option for everybody.
So then there's a question, families are also asking for the flexibility to hire senior staff to oversee their team of self-directed employees, similar to the role of a group home manager. Do you see this as a role of a support broker, or is there, another way to create someone who can take some of the supervisory responsibility of the team, the SDE team?
I think it would depend. So that would depend upon the person and the role and what the person's needs would be. So you would want to build your own team, whatever works for best for the person. Whether it be a staff that you've had for longer, or there's a need for a support broker to help figure out, what's going to happen Monday, what's going to happen Tuesday, what's going to happen Wednesday, what the activities are on the weekend. So I think everything should be customized to the person. So it could be a role, or it could be a support broker role. It would just depend upon what the job responsibilities were. And then in looking at that, you'd want to utilize some of the tools that we have.
So then another question, if you're hiring staff through a home health agency, not using an FI and not a provider managed, is that considered self-direction? I think that's considered self-determination.
Yes.
I think that's what Trish was talking about in an earlier slide, right?
Yep, exactly.
But self-direction, as Trish pointed out earlier, is when you're using the fiscal intermediary, either Easter Seals or PPL. Self-determination, person-centered services is what the whole system should be based on.
Yep.
But that term self-direction is a national term that refers to using a fiscal intermediary. That's all the questions in the chat. Does anybody have a hand to raise or something else to add to the chat?
And I can tell you that anything that I did bobble on the questions because I don't have good answers yet because our system isn't there. One of our goals of this new unit is to make sure that we get the answers for you and to hear what families are saying and to work forward and to make sure that everyone is, listened to, and we bring forth all these issues and barriers that are in place. So right now we are listening. We've had some meetings with just family groups just to listen to hear what barriers they have, where we can try to make changes, where we can come up with potential solutions, mostly potential solutions. Like, what are the solutions? How can we get there to make this, the most person-centered system and have people have the ability to choose provider managed, self-directed, and figure out what works best for each person. So that, again, I'm going to just say it because I do say this all the time, but that all people should have the right to live, love, work, and play within their community. So we can have a system that is focused directly on that and have access to everything that everybody else has in the community, and have the abilities to do that.
Trish, can you repeat the answer to the question about can parents of special needs children be, sorry, I lost it, but can they be the self-directed employee? Obviously that didn't get through clear enough. So can you repeat that?
Sure, that is actually in the manual. So yes, now parents can be the self-directed employees, and Dinah had her hand up, so.
Well, I want to go back to the question that was posed a minute ago, in that it takes a parent's significant effort to oversee and schedule and manage the activities. The question about a house manager, especially as parents age and fear, their own demise, how does one pay the house manager in that they will be overseeing, and it is illegal double dipping to have two people at the same hour. So how does one structure that so a house manager could fill in for the, let's say, the mom role who oversees all of this? How do you envision that happening? Financially?
Right. Well, a lot of times that would be seen as the role of the support broker to figure some of those pieces out, because they would be a different service. But if somebody, we'd have to sit down and figure that out with each person. But it would be more the role of the support broker.
But even with the support broker, Trish, you might still have 4 SDEs that would need to assemble at the same time with the support broker if the support broker took that role. So there would still be that issue. So maybe some consideration to using some sort of a payment stipend, like a training stipend during those,
And then
meetings.
Right. I have that actually in my notes to go over when with the conference, because there is another state, I want to say it was Utah, but it could be Oklahoma because I have to go back and look, who has an actual, that's actually part of, it's written into their waiver as a service.
I just want to add one thought, and that is that all of us know we're going to meet our demise and hopefully our children will outlive us. And the fear is if you can't develop this house manager who in fact could fill in for the mom role, that's ultimately what we want to do, at least in my own mind. And I know Mary Claire Gomeringer has talked about this, but that is upwards of 15 and 20 hours a week. You know, it's not a few hours a month kind of a role. So I just want to throw out that that is something that as a parent, I would love to see. I don't know financially or, you know, in duplicating of hours, how to make that happen.
Right.
Thank you.
So there's a hand up, Darlene Reeves.
Thank you. I'd like to say the SDE is a very good idea, and it does give a lot of flexibility to families. And I think it's very important that information and resources is available to the advocates of the for self-directed employees and for our IDD population. When you're with the agency, they have a lot of resources in terms of like GPS tracking, and that's something that we don't have access to, even though we have the electronic verification under the fiscal agent. But actually, when someone's taking a loved one out in the community, we need to be able to monitor, you know, their location. Because when you're with the agency, they have that capability. So basically, I'm just saying, like, you know, training and information and resources is very important for us to stay up to date, you know, what's happening in the SDE world. And thank you for allowing me to have my comments.
Thank you.
Are there other questions? Other people want to raise their hand? There's something, and I'm not sure Lynn McEntee wrote this, but maybe you could unmute and explain. It says administrative code, procedure code, question mark, question mark. Can you address that?
Yeah, I guess when I think about, you know, individual supports, we have procedure codes for a staff person that is delivering the support directly to the individual. And what we don't have is a procedure code for the oversight. And I think that's what Dina was talking about, you know, Mary Claire, you know, maybe there is a possibility, and I don't know, under Medicaid for a procedure code for administration. So it's the administrator of your team. It's your quasi supervisor, group home manager, whatever you want to call them, but they assume the role of the guardian or parents after they are no longer present. I think support brokers are going to handle pieces of this, but they're not going to handle they're not going to step in and fill the role of the parent. And that's what I think everybody's biggest fear is, about how quickly the self-direction can be undermined, you know, once the family is no longer present. So just it's an area to really troubleshoot and think about. If there's feedback from others.
And it's already on our, Lynn, it's on my radar. It's on my team's radar. We are going to try to figure these pieces out, but it has to be the way in which our waiver's written. We have to figure, I mean, this is something that is definitely, I was trying to jot down as much information as I could last week when I was learning from other states as to what they're doing and what's worked and what hasn't worked for this piece of it. Because we hear you on this piece, and this is part of our, okay, so we're going to listen. We have to figure out some solutions. Who do we need to go to for some of these solutions? So I've started some of the preliminary conversations with Jonathan and with Kelly Rice about some of these pieces as well. So that we see that, but we're kind of in that phase where we need to hear where all the pieces are, come up with solutions, and then try to figure out next steps. So yes, I completely hear all of you on all of this, and maybe next, you know, if I come back to this meeting next year, I'll have some better answer for you on that part of it, on the way in which things are, but that's kind of where we are.
Well, the fact that you're listening and you hear a consistent stream of, I'm sure every meeting you go to, it'll be something similar. Then that's half the battle. Now we just need to get to the solution. So thank you for listening and hearing those concerns.
We're glad
Diana?
you're bringing them to us so that we can actually come forward and make some significant changes. I mean, that's the piece of having that infrastructure of self-directions here, and it's going to stay, and here's how it's going to keep going and how strong it is.
There's a question. Are there any participants linked to the Bureau of Guardianship Services receiving self-directed services?
There's a small handful.
Okay.
I don't know the exact number, but I do know that there is at least a handful.
Do you think there would be more if guardians were more aware of self-direction? I don't know, maybe there's a guardian even in the presence of tonight's session, but is there more opportunity for guardians to have a better understanding of self-direction and help individuals who want to pursue
We
self-direction?
could definitely do outreach. We can do this almost the same presentation to them, but it might be good to that, and that's a good point to point out, Mercedes, because that would be something that, you know, and I actually used to work pretty well, very closely in the past with the BGS Bureau Chief.
So BGS is Bureau of Guardianship Services.
Yes.
And then there's a question, can they take over for aging guardians to keep participants in STE? Is that, I think they are asking, can BGS, Bureau of Guardianship Services?
They would have to
take
be
over?
named as the guard. They'd have to go through that guardianship process.
Right.
But that is a great point. And one of the next, batch of folks that we outreach to educationally, because we want to make sure that we get this information across our system. So not just, what self-direction is. So, and I've had some conversations with James Shirelli for the intake. So as people walk in the door, they know, what self-direction is. They get the information, they get the, we have been working with our waiting list families as well. So as they are reaching the top of the waiting list, we're getting them the charting and life course tools, the integrated support star. We're working with those families so that when they, work with their support coordinator and say, I've been reaching the priority waiting list, here are the tools. I started to work on my tools, and then it's bridging the gap with the support coordinator so that they understand. So we're working in concert with that unit so that they understand what, what that means, what those tools are, and they're not just, going through the plan. They're actually listening to hopes and dreams. What works for somebody, what doesn't work for somebody in their future, and figuring those next steps out so people can achieve better success in their lives. They don't just have the same plan year after year. So we move forward with all those next pieces. So we're trying to do this across the system. And we're in the early, we're in the really early phases right now, but as we started with our waiting list families, because that's what my unit's also working on, the waiting list. We started with our waiting list families. I've been partnering with everybody who's part of our Trying Life Course community practice group. I know there's some additional ambassadors that are in this group as well. And we've been working with all the regional family support planning councils. Kyoko and I are ambassadors, and we did, and Gabrielle is on here. I see Gabrielle's on tonight. And we, early on, you heard us do the integrated support star, and you heard us do the trajectory. So getting that information out there so people can make that informed choice. What do I want to self-direct? Do I want to use provider managed? What are my next steps in my life? Trying to figure all those pieces out. We want to get that infused within the whole entire system so that people can make really good choices as to what it is they're looking for. I know that if they don't, if something's not working, they can change it at any time. It's a living, breathing choice. So we are trying to gather that information and move forward. So go ahead, Dinah.
I loved that you said you're trying to get self-direction to be part of any future policy so that when the administration changes, self-direction does not fall apart or have significant upheaval, and there's this begathon, please give us back the services. So I applaud and underscore that that's really important.
Some of us have lived through that. So yeah, we want to make sure that that's part of it. So thank you, Dinah.
Thank you.
So Marilyn writes that I was an SDE for my son. It just ended last week, about a year later. Is that, I would hope that was by choice, Marilyn, and not for any other reason, because I did hear at one point that a family was told by a support broker that they couldn't continue to be an SDE, and we kind of had to get that fixed. Marilyn, do you want to comment on your?
That was by choice purely. I
Okay.
didn't want to eat into my son's budget. I really need other services for him, behavioral being number one. So I was like, no, that's it. I mean, I had to do it because he was with me since COVID started 24/7. You know, there was nobody else. So I was actually, somebody mentioned it to me. I actually probably did it for more than a year, you know, and it was fine. I didn't have any problems. And they even said you can continue doing it, but I really need his budget for other services. So I will sacrifice that. That's not a problem for me.
Thanks, Marilyn, for clarifying. I'm glad it worked for you for the time that you used it.
Yeah. Thank you.
Someone writes, I had a guardianship organization tell me this week that they are not insured to provide guardianship for individuals not in provider managed care.
So Gail, I just sent you a message that get me that information and write into me like tomorrow or the next day, and I'll try to get you some additional information. I don't know where that's coming from. So if you just write me and we'll try to get you an answer.
Can you hear me?
Yeah.
Okay. It was a guardianship corporation that handles many people with disabilities. I'm up in Sussex County. And after many months of speaking to them, they've just told me, oh yeah, but we're not even insured to do anybody who's not in a group home or supported apartment. So that was a bit of a shock.
Yeah, I don't know if you, again, we can look further into that.
Yeah, I've had a couple other contacts with another organization.
Okay.
I also got turned away. So it's concerning.
That's something we can also research for you.
Okay.
This last comment so far in the chat basically is that underscoring of time of the essence. It seems that we're giving a lot of work to families, particularly elderly families, working parents, and we just want what's best for our kids as the division wants, you know, what's best for people. So at what time can we arrange all of this for them so that there's not this hoping that someday there's a policy change, but actually being able to rest easy and know that things are set up for the future. So I guess that's more a time of the essence. The sooner the better. Tonight would have been great. Tomorrow's even all right. Next week, no. A lot of pressure, Trish.
We're doing the best we can, but for those of you who know, we will try as hard. I mean, our team's pretty strong, and we will, you know, push forward and try to learn as much as we can from whoever we can. That's one of the other quests that, you know, I've been kind of venturing on, is to, you know, learn from what's worked best in other states. And when we started to build support brokerage, we, you know, asked some of the other states and what they were doing best and what didn't work for them and what did work for them, and try to figure out how we can shape it to fit within our waiver guidelines and our program manuals. But it wasn't like we just built it from what, you know, when John said we need to really build it, he and I were sitting down talking, we put together a group, and that group consisted of folks from the DD Council, folks from a whole host of units, families, support coordinators. They're part of the support broker network, and we met for a while to come up with how we could implement it to the part of the Bog Center as well, how we could make it work within our waiver guidelines that were just there at the time, and kind of make sure that we could support families to build support brokerage. And that, you know, that's evolving. So we are going to do whatever we can to make this work, and also get national standards, find out, really learn from what other states have been doing and what, you know, what works. So we were the 19th state to join the community of practice. We're kind of in the middle there. We're learning from what's really worked and hoping to kind of pave the way. So we will definitely, again, we're just trying to absorb everything that families are saying to us and build it. Make it enhance upon it.
And I would just encourage folks listening that if you don't get an opportunity to see Trish or some of her team at another session sometime soon, just check in, send a note to the help desk, ask them where they're at with certain things. Just keeping it top of mind and letting them know that this is still on your mind. I think your team would appreciate that, Trish.
Yes, we definitely would.
Can I just share two things that Nita Das, who had been in self-determination and been a support broker decades ago, had shared when I set up my home for my daughter. And one was, we hired a live-in aide, and she not only got paid 40 hours a week, but she got room and board. But one of the caveats was that if there was a superstorm Sandy or someone called out sick, she was to fill in, which is a wonderful model for her and for us as parents. And the other piece I just want to share is that we have a wonderful young woman, college educated, who knows my daughter very well, who always looks for fun activities in the community, concerts, shows, music, outdoor hikes, all kinds of things. So I just share that there are ways that this can really work, and that self-direction has allowed my daughter, who does not read or write or count 10 objects, to have a very rich, fun-filled life.
So someone asked, thanks, Dinah. That's an excellent sharing. Someone wrote, they wanted to know if there's an email address. So I think it's ddd.oesds, Office of Special Education @dhs.nj.gov.
Yep.
I'll put that in the chat. OESTS. Okay. Kyoko is always quicker at typing than I am. So there you go. You have it twice in the chat. So that's the email address that you can use for communicating with that office, with Trish's office and her team.
Yep. Our team members are always, and we have different folks assigned to it each day, but somebody is always there answering, and we will get back to you. And if we don't have the answer, we will make sure we get you the answer.
So Margaret and Dinah, I think there's one more thing maybe. Is there a list of persons that are interested as working as a self-directed employee in New Jersey? So looking for employees. I know, Trish, I don't know if you want to talk about that.
So we don't have a list of people who are looking at employees, but I can, I know that there are some folks here, and I know that the council actually supported some of the pieces of the New Jersey Collaborative's integrated support map. So that's kind of, there you go. Jen just popped it in. I was just gonna, she's quicker. Which is awesome. Yep, there you go, Joe. I was just gonna top it over to both of you because I know that that was one of our topics in our support broker network, and that group is doing some awesome work with putting together that map. It's a helpful resource that families have been using. There's other additional resources that people have been using as well. Again, write into us. We'll provide you whatever TA that you're looking for, and we can, work to help you along the way if you're trying to figure out, okay, so what works for self-direction, what doesn't work. That's our whole goal of our unit, is to educate people on the principles, the philosophy, the next steps. Help us you're going to help us figure out some of the barriers and how we can plug through them. And you guys have been great about that. And I thank you all for inviting me tonight. Well, you invited me a couple of years ago, and Margaret came up to me at a meeting a couple of years ago and said, hey, will you be interested in coming to our meeting? And I said, sure. And a lot of things have grown since then, which is extremely exciting, because now we're actually using some of the Trying Life course tools, and we have support brokerage is really launched and starting to grow. And we now have a whole office that's going to educate people on what self-direction is and go out to different folks. I know we're going to another Regional Family Support Planning Council in a couple weeks. So, you know, if we did recently did the Bergen County Special Services School District, they asked us to come. A couple other providers have asked us to come out. So Lynn heard the support court. We went to Skylands for support coordination, and Lynn heard a very similar presentation. But you know, I think the more each time you hear something a little different. And we want to make sure that folks are getting, you know, the glossy overview. And then when you want the nitty-gritty details, you can come to us, and we may not know the answer. We may need to seek it out, but we will always respond to you and get you some sort of aspect, or even look into it further and try to plug forward. And if we're not, you know, I know that some of you, like Dinah, I know you'll be there, and Mary Claire, and you'll be saying, you know, yeah, we said you're going to get my answer. Where have you gotten so far? So just keep on us. We will continue on. I promise that we will. If we don't have the answer and there are some barriers, we'll try to work towards some sort of a solution.
I'd like to take this opportunity to say a genuine thank you to you and your team. It is wonderful to have a group of DDD personnel who are focused on self-direction, and we thank you for the work. We know it's not completely easy, and all answers aren't going to be evident right away, but I want to say thank you for coming to speak with us. We appreciate it.
Thank you.
Thanks so much, everyone.
Bye-bye, and thank
Thanks, Trish. Thanks. Bye.
Thank you.
Thank you.
Good night.
Bye.